In a serious setback to Nigeria's polio-free certification, fresh cases of the polio virus was detected in internally displaced camps in northeast Nigeria. This raised questions on the capacity of Nigeria's health system to handle outbreaks of diseases. On this week's edition of the program, my guest talks about Nigeria's primary health care system. Hello there, thank you for joining us on the program this week. I'm Gloria Umezuki. Primary health care facility is often all that rural communities have in form of a formal health system. While the delivery of quality primary health care services can have a large impact on the health of Nigerians, we will be talking about primary health care services with my guest, the Acting Executive Director of the National Primary Health Care Development Agency, Dr. Emmanuel Odu. But coming up next, Nigeria joined the rest of the world to mark the World Polio Day with a determination to intensify vaccination across the country. Take a listen. Nigeria's polio-free certification suffered a major setback in August 2016 when 4 new cases of wild polio virus was reported in the northeast. The federal government immediately launched an emergency response team to curtail the spread of the virus. At this press conference to mark the 2016 World Polio Day, the Minister of Health says the government has spent over 8 billion naira already for vaccination.
Directly, we have released 9.8 billion naira meant for polio campaign, and this is being utilized. When the exercise is over, we will sit down and take stock and render account. Our vision is that, as stated by Mr. President, to have a Nigerian-free polio, Nigeria that is free of polio in 2017. And when Nigeria is free of polio, Africa will also be free of polio.
Meanwhile, the country's chief of health for UNICEF is urging the government to strengthen the nation's primary health care system in order to consolidate the little gains already made.
At the point, you will remember very well the minister's agenda on renovating 10,000 primary health care facilities in Nigeria. I think that's in line with that, to ensure that these primary health care facilities do exist and are capable of providing a comprehensive package of services as defined in the ward minimum package in Nigeria. 1 primary health care in each ward in Nigeria.
At a separate press conference, the Senate Committee Chairman on Primary Health Care, Senator Mao Ohabunwa, emphasizes the need to strengthen routine immunization for children under age 5.
We also want to reiterate the importance of strengthening routine immunization with strong routine immunization programs. Structures at primary health care center level to strengthen routine immunization should be supported.
Over 30 million children have been vaccinated in Nigeria against polio in the 3 rounds of emergency response to the recent outbreak. Health experts are hopeful that if the efforts are sustained, Nigeria can again attain the polio-free status in the near future. I had a conversation with Dr. Emmanuel Odu, who talks about efforts to fight polio and how the primary health care services are used to address health in rural communities. Dr. Emmanuel Odu, you're welcome to the program.
Thank you very much.
In August this year, Nigeria experienced a resurgence of polio. And that really wasn't expected after 2 years of reporting no fresh case of this virus, really. We almost attained the polio-free status. What happened?
Well, thank you very much. Let me give a background like you mentioned earlier. The fight against polio, and polio, which is really a crippling disease which can sometimes kill, is a highly infectious disease caused by a virus known as the polio virus. By 2009, approximately 798 children were paralyzed in Nigeria, across Nigeria, by the virus. With concerted effort, by the federal government of Nigeria, along with other development partners, the number of children paralyzed came down to 388 in 2009. With concerted effort, including mobilization of traditional leaders, especially the northern traditional leaders, we supported them to form a committee of advocacy as well as community mobilization, and with our joint effort with partners and federal government support through resources and personnel and vaccines, as well as strengthening cold chain system, the number of children paralyzed came down to 21 by 2010. There was a slight increase between 2011 and 2012, whereby by 2012, 122 children were paralyzed across the country. And as a matter of fact, at that time, 2012, Nigeria accounted for 50%, that is half, of total number of children paralyzed across the world, that is globally. But again, we worked hard, the federal government of Nigeria, through National Primary Care Development Agency, Federal Ministry of Health, development partners, and other stakeholders, both at national and subnational levels, worked together, intensified activities, and then the number of children paralyzed came down from 122 in 2012 to 53 in 2013. And there, with further progress, the number came down to 6. We are glad about the decrease, even though still worried about the fact that even 6 children were still paralyzed. No child will be paralyzed by polio. That is to 6 in 2014.
Right.
And that was in July, specifically on July 24th in 2014. And the last case at that time was from Samaila local government area of Kano State. Thereafter, there